Tomorrow, for thousands of people across the Bay Area, it could be more difficult to get an appointment with a mental health therapist.
That's because roughly 2,000 mental health care workers with Kaiser are going on strike. KTVU's Greg Liggins has more on the issues and the impact on patients. Greg?
Their picket lines go up tomorrow at 6 a.m. Now, these mental health workers have been without a contract since last September, according to their union. Negotiations failed yesterday, and workers say the sticking point is not money.
About a dozen Kaiser mental health care clinicians were outside their union's Emeryville office Sunday making picket signs preparing to strike. Although reps from the National Union of Healthcare Workers reached an agreement with Kaiser on wages, another issue remains outstanding: the demand for Kaiser to hire more workers to alleviate an overburdened segment of their workforce and help meet the growing demand for patient care.
It's about the fact that Kaiser patients have to wait months just to start therapy regimens, and once they start a therapy regimen, they're waiting 4 to 8 weeks between appointments.
That's because there aren't enough mental health care workers to meet the demand, something even Kaiser acknowledges. And the union says mental health workers are quitting in droves.
It's gotten to be a crisis within Kaiser. They can't hold on to clinicians.
Kathy Ray, a social worker, will be part of it. She says in addition to the face-to-face hour with clients, there's important collateral work Kaiser isn't giving her enough time to do. She says she and others are stressed to the point that the therapists need therapy.
That's why they're leaving. It's unsustainable. It's a crisis that we're in the midst of.
Kaiser says in a typical 40-hour week, therapists get 34 hours to see patients and 6 hours for administrative tasks. Kaiser says it's offered to increase that 6 hours to 7.2, but that the union wants 9. Union reps say that's inaccurate and that what Kaiser calls administrative tasks is actually important work related to patient care.
Right now, it's about the therapist would get about an hour a day to do that work, and it's not nearly enough.
Regarding the strike these workers are preparing for, in a statement Kaiser said in part, for the entirety of its 12 years of existence, NUHW has used the threat of strikes as a bargaining tactic in every contract negotiation. The strike will include workers such as psychologists, clinical social workers, chemical dependency counselors, and others. And with no new negotiations planned, the strike timeline remains open-ended.
As long as it takes. Incredible unity and determination.
The strike will begin in San Jose, San Francisco, Sacramento, and Fresno, and then rotate to other cities. Kaiser says it's hired hundreds of new mental health clinicians, including 200 since January of 2021, and they added they're working hard to be ready to meet the needs of mental health patients who need help during the strike. Greg Liggins, KTVU, Fox 2 News.
All right, 12 hours away, 6 o'clock tomorrow morning. Greg, thank you.